What's going on, guys? Welcome back to the PT Coffee Cast, brought to you by The Movement. My name is Dalton, and alongside me today is my beautifully bearded friend, William. William, how are we doing today?
Doing pretty good, man. I feel good, rested up, ready to go for another week. How about you?
I'm doing well, man. You know what I'm excited about?
What are you excited about?
It is tuck your pants into your socks season,
Is it?
and I'm super excited about it.
I shoe.
Hey, I don't know how appropriate of a physio outfit this is, I don't know if it's professional enough, but
Yeah, I'd recommend suit and tie personally, but that's just me.
yeah. Maybe I'll tuck my suit pants into my socks.
Yeah, I think that's probably the way to go if I'm thinking about it,
Yeah.
but it's up to you, I guess.
Guys, we're excited to be back with another episode. We are continuing on today with our clinical question series, a slow drip of some of our favorite questions. I think this is question number 3. I like this one. Today's is a Musk. I've been reading Elon Musk's book. That's why that came out.
There you go. What's that called? Like where it's like unconscious. I don't know. Keep going.
This is a must-ask question, for sure. But before we get into it, if you aren't subscribed to the podcast, make sure you subscribe on all podcast platforms. If you aren't following us on Instagram, head over there, follow us at PT Coffee Cast. We launched a website for all things podcast and mentorship. If you're interested in any of those things, head over there. It's themovementmentorship.com. You can get all of our resources there, podcast episodes, more about the mentorship. You can schedule a call with me to dive into the mentorship and see about getting into our next cohort. We're really excited about it, so make sure you check it out. And then lastly, if you want to see these beautiful socks these beautiful pants tucked into my socks, you can head over to the YouTube channel, subscribe there so you can see that. But let's dive into this question. So, we were talking before the podcast. This is definitely one of those questions where I think you need to be asking it every single time on the initial assessment with a client, and that is, what experience have you had with a physiotherapist in the past? I think this does a lot of things. We're going to dive into like some examples that we've had, but maybe off the top, you can kind of lay out some of the things that question is used for.
I think the main thing it does is it helps you pull out things, one, for really good conversations, but 2, to make sure that you're on the same page with the client and that you are aligned in terms of what to expect, from the session and like going forward working together. So I think broadly that's what I would say. I think the answers can go in so many different directions, but often they're like very important things that if you don't capture can really end up destroying the trust and leading to a situation where you don't continue with each other.
Totally. And I think you've used this in the mentorship before, and it's one of my favorite things is like surprise kills trust. And I think that's what this question does, is it tries to eliminate those surprises. So it gives you an idea of what that client's experience has been, where they're at, and that could be nothing. Maybe they've never experienced physio before and have no idea, and that's great because like it's a blank slate and you now have an opportunity to provide an amazing experience for this client and show them what rehab is all about. Or they've had an experience in the past that's really going to dictate where you go with some of those things immediately in your initial assessment and moving forward through the plan that really will help set them up for success. And if you don't get those things out early, it can really blow up the trust or just lead things down a path that aren't going to be successful.
Yeah, and like even in that first situation where you have someone who's never had physio before, it's like, well, I'm probably going to explain things even more with them in terms of what I'm doing, because if they've never been, they might not know, for example, that they might experience pain during the assessment. Right. So like something as simple as that is like, I need to like be more communicative. Like I'm going to do that every time, but with that person, maybe even more so. Like, hey, like, just so you know, some of this stuff might cause discomfort. So I'm going to go slow. We really need to make sure we're communicating. Like just that's kind of what that question can open up for you, is like, what do you need to dive more on into?
Yeah.
I was doing so good there.
You were crushing it.
But does that make sense?
Yeah, totally. And I think that opens up more questions. It's like a lot of times if someone has a blank slate, I'll ask them, well, what do you think physiotherapy is? And again, it just, everyone has some kind of idea of what it is. You know, if you type it in on the old Google and it's all about how we're going to reduce your pain and we're going to hook you up to all these modalities and we're going to poke and prod you a little bit, you know, which obviously we're trying to change that narrative, but getting some idea of what they think of physio, even if they haven't experienced it before, is important to like setting them up and yourself up for success.
That's a good point, because just because they haven't experienced physio before doesn't mean they don't have expectations about what it's going to be.
Yeah, they know somebody who's had it. They've Googled it. They've seen it in a movie. They've seen it on TV with sports, you know, like who knows?
Ryan Gosling, the physio.
Yeah.
Coming up soon.
But maybe let's take it to an example. Like, I know you mentioned a couple things that have happened recently with you asking this question, and we can kind of dive into that. It might help.
Well, I at least remember one, so I'll
Start
go into
with
that
one.
When I had a client, when I asked this question, the client was talking about how they had gone to physio a while ago, didn't have a great experience because they just had them do clamshells, and it wasn't very intense, and like they saw themselves as wanting to get back to like high level activities, you know. And so I now can see, right, like if I don't show this person how I can make this progressive and how to bridge the gap between where she was now and where she wants to be with her activity, then I'm gonna miss out, you know. And sometimes I don't go very intense on day one, but there's reasons for that, right? And it definitely doesn't mean it's not going to get intense. So let's say I didn't frame that very well, then I could lose that person just because I didn't understand their concern from their previous experience.
Yeah, for sure. And like, yeah, I think that gives you a ton. Like when someone is saying like I wasn't pushed enough or I wasn't challenged enough, I think going forward with that is super important to know, because now, like you said, one, maybe it's not appropriate to challenge them on that initial assessment, and being able to explain that to them. And a lot of times in that situation, what I'll do is I'll be like, hey, we're going to try this. And then I'll explain to them progressions of how it's going to challenge them more down the road when they get there. But for now, we need to make sure, you know, that we start here and we build off of it, right? And then even knowing that when we're talking about delivering an effective plan, which, you know, we're using our 3-step process, you can talk about how it's going to progressively get more challenging and where we're going to push you. And I talk about this often in most of my assessments, but I would even emphasize it more with this client. Is the bridge the gap phase between rehab and performance is often a phase that gets missed in rehab, both by the clinicians and the clients. And like what we really want to make sure we do today, or make sure we do with you on this plan, is take you through this full spectrum. So in this phase, we're going to make sure that we expose you to everything that you need to be exposed to be able to get back to X. And we're going to make sure you feel confident and your tissues are tolerating that before we say, hey, we're done. Because this phase is often where people miss. They don't go through the full spectrum. They go back, they get re-injured, and then they're back to the start. And we want to avoid that. You can really spend a lot of extra time like highlighting that so that they see, hey, like this person is going to challenge me and they're going to fill that gap that I missed in my previous experience.
I feel like you could also ask about their previous experience and highlight how the way we're going to approach it is different. Like, for example, I'm sure if I asked about this more, it would have led to, yeah, I saw the physio for 5 minutes, then they left me, right? And so I can explain, hey, we're never going to do that. We're going to be working together, right, through this. And I think just highlighting how it's going to be different with us working together can highlight some of those points too. But also, I'm probably not going to do clamshells.
Yeah.
right? Like, even if that's a reasonable starting point, like, I'm not going to do it because of that experience. I'm going to just pick another movement, right? That maybe has a perception of being a bit more advanced.
Yeah, and kind of going off on a little side journey here with this thought, but I think this question does so much for what we talk about, which is, as physios, as coaches, as people who are trying to get people to commit to a process, you need to identify problems or barriers or challenges that client has had in the past, and then you need to position yourself as someone who has a solution to help them solve those problems. And this is a good example of how asking that question early on is now going to change the whole trajectory of your initial assessment. I know, having worked with you and how I would do this myself is like, you're now going to think about, okay, how can I lay out the rest of my objective assessment piece and then the last 15 minutes where I'm going to deliver the plan to help highlight that barrier and how we're going to help solve that barrier to get her back to doing what she wants to do. And that's going to drive a lot of your special tests. That's going to drive a lot of your assessment tools. That's going to drive a lot of what you do on the whiteboard. And that's how you become more streamlined and intentional with your assessment versus like not asking that question or not taking that question's response serious enough. And then you're just going crazy. You're just doing a bunch of stuff. You're not really having any direction. And we talk to a lot of physio students who talk about the hardest thing for them is they don't really have a framework or an approach, and they feel like they don't know where to go with tests, and they're doing all these things and they don't know what information they're getting. It's like, that's why you need to ask the right questions. You need to have some frameworks for how you implement an initial assessment, how you deliver a plan. And those are things that you can start implementing right now that require no other new assessment tools or anything like that. And this one question can really drive a lot of that.
And if it's like, this is what we're calling the subjective interview, right? But it's really just like that type of information can be so much more important than even asking the specifics about the person's knee, because like a lot of times it's like, in this situation, knee's been hurting for years. It's like, I'm not gonna gain that much information from asking her a million questions about her knee. Like, I'm still gonna ask some, but it's not nearly as important as understanding all those things, right? Because that's actually going to steer what I need to be highlighting through the assessment and showing them.
Yeah, totally. And I think that's like knowing the client in front of you and realizing how you need to approach it. And that's why we talk about teaching principles a lot and have frameworks, because like there's so much individual difference between every client that comes through the door that there's not just one way of doing it. But if you have the principles and the approach, that can allow you to adapt to the client, because there might be a situation where, you're not, in this case, you're not spending a lot of time talking about the knee specifically. You're getting what you need and then you're moving on. But there might be someone who comes in who is so hyper focused on their knee and their pain and their everything that's going on with that. Even if the barrier is, I didn't get challenged enough in my last physio assessment, you're not going to just skip over the fact that all they've been talking about is their knee pain and how they feel that something's going on in there. If that's the case, you're going to adapt to that, and you're going to identify, and you're going to spend a little bit more time there and then circle back to the barrier that they highlighted. Just wanted to put that in there. But again, I think the main point is like asking this question can unlock a lot that will guide you in your initial assessment.
And like a situation like you just outlined, your subjective portion might be 30 or 40 minutes, right? Because it needs to be. And then you're using that in a targeted way to guide what you're going to assess. And it might be one really important thing to get them started. But the key is making sure you're on the same page and you have a good scope of the problem. So I think that's where like that question is a must ask.
A musk or a must?
Did I literally just say what you said?
I don't know. I'm asking.
Are you? That was like Inception.
Is it a musk ask question or a must ask question?
It's a musk ask.
No, I think that's great. Is there anything else that you want to add to that?
I don't think so. Like, I have more examples and stuff like that, but I feel like, I don't know. What do you think?
I mean, I think the other side of it would be we could maybe go a little bit deeper into like if someone didn't have an experience with physio before, like how you would maybe approach that. Because I think sometimes that can be kind of a little bit overwhelming too. And I think what I've developed over the years, and we kind of set our clinicians up here for success with talking about this, is how do you really respond to that question? Because that's a good opportunity for you to lay a lot of like expectations out for your client.
Yeah, so this is a situation where you ask them what their experience has been like with physio, and they say, hey, this is my first time.
This is my first time at physio, and let's say you ask them a little bit about like, hey, what do you know about physio? And they're like, well, I don't really know much. I know they like you do some movement, and you're gonna help me get rid of my pain.
Yeah, I mean, so then what I would do is I would lay out what the session's going to entail, which I think people don't do enough.
Yeah.
Because like even just what is an objective assessment, and what are you going to do and why are you doing it? How does it help you help them? Mm-hmm. I think can be something huge. And so I do that every time, regardless of whether they've been with a physio or not. I kind of lay out, usually I ask them that question, and then afterwards, if there's nothing really else to like talk about, then I'll go into and I'll just say, hey, do you mind if I tell you a little bit about what's going to happen today? And they're usually saying yes. and then I just kind of explain it, and I go through the process.
Yeah, and I think that's a good opportunity to like, lay out expectations. Like a lot of times I'll do the same thing and I'll just tell them, hey, we're going to talk a little bit about your story. We're going to have you share like, what you feel like is relevant information to me. And that can be whatever you feel comfortable with sharing. I'm going to ask you some questions along the way. You can ask me whatever questions you want that pertains to like what you have going on. And then after we dive into that and we make sure that you've covered everything, we'll move into the objective portion, which requires more of some movement and some strength testing to identify areas that, we can work on and optimize, and maybe identify some areas that you're really already doing well. And then we'll take that information, we'll put it together into a plan, and we'll sit down and talk about how we're going to work together towards, moving you towards getting to your goal of getting back to running. How does that sound, or what do you think about that?
Sounds great.
All right, take it away. It's usually what I say. But yeah, I think that's like covers a lot of the basis of what's going to go on. And I think if you ask people like what questions you have with that, or what do you think, like if they have something else that they want to maybe that you missed that they want to know about, they'll add it in. Like I've had people ask me about like, hey, like what about like doing some treatment or some manual therapy or whatever, and like just gives you an opportunity to like have that conversation then and set expectations and then move into it, versus like you get to it or you don't get to it and they're like, well, why didn't we do that?
Yeah, and I think like that whole spiel is like something that you can get better at as you practice it, because I think there's a lot of like, for example, like I've gotten more comfortable with getting more detailed with that, because I think people, for example, like sometimes don't know when we're doing a subjective, like I really want to understand them and like what they want from the experience and what their goals are, because that's going to help me with knowing how I can help them and set them up for success. So like, cause I've had situations where, for example, like I start asking personal questions or like whys, and they're kind of like, why does it matter? My knee is this, and this. And so just like getting better at like understanding how you can really set expectations well, like there's so many ways that you can level that up.
Yeah, it's a good point. And I mean, like, that's something that I could maybe do a little bit of a better job, even just you mentioning that, is like highlighting that part of the subjective, which is obviously really a main goal of what we want to accomplish. Pre-framing that is a great idea, and I don't do that probably as often as I could. So it's a good example of how you can like constantly refine it. And this is just years of practice of like saying it, and I still struggle getting it out sometimes, and like when I first started I sucked ass at getting it out. It's just part of like the process of you're going to stumble through it, and then you're going to figure out your flow, and then you can refine your flow like once you have that flow consistently put out there.
I think one thing that both of us have realized though is just like how important that is, you know?
Yeah.
Like as we've gone year to year, we're realizing more and more how that type of thing is what really makes or break the relationship that you have, the therapeutic relationship you have with somebody.
Yeah. Yeah, I agree. Okay, I think that's good.
Cool.
Okay. So this is the third question of our clinical question series. It's a must-ask question, and it is, what has your experience been like with physio in the past? If you guys want to follow us on Instagram, make sure you head over there, follow us at PT Coffee Cast. If you aren't subscribed to the podcast, make sure you do that on your podcast platforms. If you want to see our beautiful faces on the YouTube, subscribe to the YouTube channel. And then lastly, we have our new website up. Super stoked about it. All things mentorship, all things podcast. If you want to learn more about the mentorship, you can head over there, themovementmentorship.com. If you're interested in joining a cohort, you can schedule a call with me. We'll dive into what that's going to look like, how you can be part of it, and then get you onboarded into the next cohort. But yeah, that's all we got for today, guys. As always, stay caffeinated. Peace.